So, I'm starting one of the most controversial videos I'm ever going to be uploading on the channel. I'm going to talk about what brain aneurysm, what it is, and why it is so fatal. And I'm just going to get this intro over with. It's going to be about 2 minutes. Let's just talk. So, I personally think that this is one of the most underrated medical conditions in the entire world. Now, why specifically I say that is there are so many doctors. I don't hate doctors at all. They're actually the reasons why a lot of us don't die to this day, because they have good treatment, they know what they're doing, and I thank all of the nurses out there and all the doctors out there. Thank you for your service. You guys do a heck of a good job. But I don't like the fact that when people come in with headaches, they're like, oh, it's just a headache, it's like something wrong with you, and they just send you back home. I don't think necessarily that yes, I agree. Not all headaches are going to mean a brain aneurysm. But I'm saying that they complain about bad headaches. You should at least try to test them for a brain aneurysm. Because, again, brain aneurysm, we're going to be talking about everything about a brain aneurysm on today's video. But I'm just saying, it is so underrated and is one of the most, less known medical conditions, because so people just cross it off their list and say that they don't have it. Like, doctors think all these people, our patients, don't have it, but in reality it's like, do we actually know they don't have it without actually testing them for it? Right now I have a headache, which I'm not thinking anything of it because I don't do any of the things that causes a bad headache, that causes, brain aneurysm. But yeah, I'm just saying, brain aneurysm, I feel like, is one of the most underrated, medical conditions out there that needs to be known, because sooner or later, a lot of people might come down with it because the treatment for brain aneurysms might not be up to date. And who knows, anything is possible. So I just want people to know that, this medical condition is not something to make fun of, okay? Because a lot of people cannot help if they have a brain aneurysm. Brain aneurysms are very bad because you have to take care of yourself all the time. You have to not even bump your head once. You bump your head once, that could actually cause you to have a life-threatening bleed inside your brain, around the soft tissue and your brain. Now, even sneezing, possibly, or straining the poop could also cause a brain aneurysm. If you already have one, it can cause a ruptured one. It won't cause a brain aneurysm if you don't already have one, but it will rupture it if you already have one. So that's why you got to be careful and actually get yourself tested for one, or the doctors need to test you for one if you think you have it, because there's a possibility you are. So again, I'm going to say this once. If you think you have this, you got to go to the hospital immediately, because this is not a fun one. 1 minute you could be perfectly fine, the next you could be dead and 6 feet under the ground and had the worst headache before you died. And it's not a joke. This is one of the most rare / most terrible things you could ever have. It's one of the most painfulest / fast killing deaths you could ever live. It is possibly one of the most, if not the dangerous, most brain condition you could ever have. Maybe 10 times more dangerous than meningitis. It hurts. Anyway, here we go. Alright, so what is a brain aneurysm? Brain aneurysm, this is how you pronounce aneurysm. Hey, Riz, let's go. Aneurysm. That's how you say it. Brain aneurysm. Also known as a cerebral aneurysm or intracranial aneurysm, is a bulge or ballooning in a blood vessel in the brain. An aneurysm often looks like a berry hanging on a stem. Experts think brain aneurysms form and grow because blood flowing through the blood vessel. So right here, this is what a brain aneurysm is, okay? So it's a big bulge or ballooning inside there, which means that in any case that this would rupture or break open, the blood would go all over the brain, all over the tissue, and bleeding in the brain does not go well, because bleeding in the brain basically damages your brain, and it can cause damage to it, and can cause a lot of things, because you're basically losing blood in the most important part of your body. And when you lose too much blood in the most important part of the body, things just don't end well for you. And I'm actually honest, things will not turn out well for you. And it's a proven fact, it will not turn out well for you. This is basically what it looks like. If it ruptures, then it causes bleeding in the brain. Now, bleeding in the brain, bleeding in the foot, that's one thing. You could take care of that. But bleeding in the brain, if it doesn't get treatment immediately, the chances of it actually like killing you is going up higher every time you don't get treated. Now we're gonna talk about basically how to stop a brain aneurysm, or not brain aneurysm, how to stop a brain we'll get to it in a little bit. So yeah, this is basically what it is. That ruptures, it will kill. They won't show any symptoms until rupture. Now, this is one of the most scariest part about an aneurysm. Sorry, my eyes hurt, head hurts. That's the only way that calms it down. They won't show any symptoms until rupture. So what this means is, you know how symptoms are. Basically, they're the things that you can basically take a hint towards the medical condition you think you have. So say you have a stomach ache. A stomach ache is a symptom of many health conditions, mental conditions. Stomach aches are pretty common. Everybody gets them at least every day, once in a while. I get them every day of every minute. So yeah, it's pretty common for me. So symptoms are basically, you know what symptoms are. They're basically what's wrong with you. And that can basically, the symptoms are basically like, what do you have? Like headaches, throwing up. Oh, that can determine the medical condition or mental condition that you have. So, yeah. Now, they won't show any symptoms until rupture. So, that could be the most dangerous part about it, is because if you go without a headache, but you actually don't know you have a actual brain aneurysm until you actually hit your head thinking it's nothing, in a couple hours, you could be in the hospital on your deathbed, flatlining as we speak, because brain aneurysms are very life-threatening, because they are bleeding in the most important part of your body, your brain. Your brain loses too much blood, it causes brain damage, brain dead, coma, death, seizures, all bunch of stuff. It's a whole ball game that can happen in just a matter of minutes. There's a story about this one little girl. It's a real story. It's all over the news once. It's basically a story about a girl who had a bad headache. She had blurry vision, had a bad headache. A couple days later, she's completely dead. So, I'm just trying to tell you, it's like one day she's fine, next she's got blurry vision, can't see well, got a bad headache, and she's dead. So, it's a very fast processing death that it will hurt you and your family forever. It will possibly even scar them for life. Brain aneurysm symptoms: mild to severe headache. So mild would be like, it could be better of a headache, could be worse. So it's basically like, it hurts but it doesn't hurt type headache. Vision impairment, that means your vision isn't in its best stage, basically best way. Your vision is just completely impaired, can't see, everything's blurry, everything's just weird. Pain above and behind the eye. I don't have it. Pain above or behind the eye. So I have pain behind my eye, but I always have it, so it's not a brain aneurysm. Trust me, I don't know what they're like, but I can tell you what they cause. I definitely don't got. So bleeding above or behind the eye. So anything, this could just be from any really bad headache, like a cluster headache, a migraine headache, or chances are the most common and most less painful headache, which is a good thing. Tension headaches, most common from stress, anxiety, and much more. Nausea and vomiting. So again, these two are probably one of the most common symptoms used for any mental or medical condition. Drooping eyelids, so their eyelids drooping. Now that could be a sign of like pink eye and other stuff like that, but yeah. A dilated pupil, that means the pupils are not as reactive as what they should be. So if you shine a light, your pupils are big whenever there's no light, because it needs more light to see. So your pupils have to get big, because when it's nighttime, there's not a lot of color or a lot of light. Your eyes gotta, try to get more light than what there would be like with light. Your eyes need less light to see. But when it's nighttime and it's dark out and you can't see anything, your eyes need more light to be able to function and to see well. Because if you didn't have that and your pupils were basically all over the place, weren't working right, then you basically couldn't see well. And basically at night, your pupils are more reactive, because you basically need more light to see. But when it's daytime, your eyes don't need more light because it's already light outside. Paralysis or numbness of one side of the face. Now again, brain aneurysm, this is a common symptom of a stroke, which is more common but yet not common at the same time, because strokes are not common in little kids, but they are very common in people with high blood pressure, high blood sugar, and much more. But yeah, most common in older people, like 50 and above, maybe even 40. But chances of you getting that beyond the age of 70, it's kind of rare, but more rare for kids to experience this, unless they have some type of disorder that can kind of cause this to become common. Paralysis or numbness of one face, I just said that, so it could be the left side, basically your face drooping down. Sensitivity to light, so if you shine a light and it hurts your eyes, hurts your head, that could be another sign. Definitely could be a sign, that's a sign of meningitis, such as other things. Now, these are all symptoms of basically meningitis on here, the next few three. So this, sensitivity to light, all that. So that's why you need to, be careful, because it could mean one of those two, which are both equally as dangerous as the other. But my opinion, brain aneurysms are more, right on the point, way more dangerous. So I would be very, very careful if I were you, because I would not want to live this painful death. And I'm telling you, it's one of the most painfulest deaths that you could ever experience in your entire lifetime, and I'm not joking with you. It's terrible. So sensitivity to light, very, very serious, because it can indicate a lot of health conditions that are very, very dangerous, but maybe not all the time. Stiffness or pain in the neck. Stiffness is a sign of meningitis, brain aneurysm, stiff neck, all that type of stuff. I mean, of course, but again, brain aneurysm can affect the neck, so that's why it causes that. Seizures, which is, you already know what seizures are. I've covered those on the channel. Seizures are very, very dangerous too, because not only could they cause more damage to your brain, they could cause a concussion, which a brain aneurysm and a concussion, I've never heard of those two. Those two together is the ultimate no-no, because those two increase intracranial pressure to 2 times. Not good. What is a headache? What headache is a brain aneurysm? Severe headache that reaches its maximum intensity very rapidly after onset, which can be a symptom of a number of serious medical conditions, typically involving the vascular system of the brain, such as stroke. A thunderclap headache is what we call a brain aneurysm headache. Now, this can also indicate bleeding inside the brain, so this could indicate a brain aneurysm that has ruptured, which causes bleeding in the brain. So a thunderclap headache is the worst headache of your entire life. It will cause vomiting, nausea, possibly seizures, and it goes away in less than a minute. But again, this is a very serious headache, because it is the worst headache of your entire life. It comes on like a clap of thunder, aka the name, a thunderclap headache. Now, this is one of the most rarest headaches ever, because, again, a brain aneurysm is already rare. Having this headache on top of that without any medical condition is rare. Now, again, there's a possibility you could have a thunderclap headache without anything wrong with your brain or anything wrong with you, but the chances of that is actually just a lot more rarer than actually having a thunderclap headache in general. So yeah. Whoo. We just read what a thunderclap headache is down here, so it might indicate bleeding or in or around the brain. So this is what I said. So basically, a brain aneurysm usually occurs when there's like blood around the tissue and around the brain itself. Does an aneurysm cause CSF, which is cerebrospinal fluid leakage? Depending on how much blood enters the space from the ruptured aneurysm, spinal fluid may not be able to drain normally. As a result, spinal fluid builds up, further increase the pressure within the skull. So this is already really dangerous. So not really, but it can cause intracranial pressure increase, which we're going to get into what that is. What is intracranial pressure increase? Delayed treatment or failure to reduce intracranial pressure can cause temporary brain damage, permanent brain damage, long-term coma, or even death. It's a build of fluid around the brain which leads to increase in the pressure around the skull. So when this happens, your brain is swelling, your skull is swelling. It's actually your brain is swelling, and it pushes against the skull, and the skull is already strong enough. So having this, basically your brain can't take anymore, and your brain's swelling, you're having seizures, you're dying, your brain is basically getting damaged as every minute as that, intracranial pressure is happening. If it doesn't get decreased in amount of minutes, you're dead. They're going to be either having a coma, as it says on here, long-term coma, death, long-term brain damage, short-term brain damage. Any of those things can cause that. Now, brain damage basically means your brain's not working. You're basically disabled for either a temporary time, which means for a couple of years, like maybe a couple of months. It depends. Could be 10 years, 20 years, could be the rest of your life. But temporarily means for some time. That doesn't mean ever. But in severe cases, death, coma, and permanent brain damage. So in my case, I just put the poor guy down, poor girl down, because brain damage means they won't even know who you are. They can't do anything. They can't talk. They're completely disabled don't even know what to do. They basically don't even know themselves. So it's better to put the sucker down than to let the person live. I'm just saying I would not want my own family member going through this. Personally, if I had it, I would want to, not be here, because I would not want to say, who are you, or not be able to talk, because my family could never, ever look at me like that. So intracranial pressure increase causes a brain mass, brain aneurysm, hyponatremia, and a big hit to the head. Brain mass means there's a big mass in your brain. Brain aneurysm is just a bulge ballooning inside the brain. Hyponatremia, low salt levels, which could cause that. And a big hit to the head, so that could be from a concussion. Now, it can't just be a little concussion. Like a severe concussion could cause your brain to swell because it's a hit to the skull. Intracranial pressure increased symptoms: headache behind the eyes, raining in the ears, blurred vision, double vision, short-term episodes of blindness, nausea, vomiting, dizziness, paedemia, swelling of the optic disc in the eyeball. Finally, but not least, what will stop intracranial pressure increase? So drilling a hole in the right part of the skull so the air will be released, and if not in the right spot, then death will proceed. That's why you cannot have untrained people too, because it's a very risky procedure. So what this means is drilling a hole in the skull. Basically, you got to take a specific drill, drill it inside in their right part, and the part that specifically is the part that you need to drill the hole in. And if you don't get it in the exact same spot, that person will die, because it's already going to kill them. If it hits their brain, they're dead. So this could just basically be the end of their life in just a matter of seconds. So that's why no medical kids or medical people can do it. They need actual trained doctors and nurses to do it, because they know specifically how to do it, where to do it, how risky it is. So it's a very risky procedure. Brain aneurysm causes aneurysm that develop to thickening or weakening of the walls. Risk factors: aging, high blood pressure, smoking, alcohol, and drug abuse, family history, previous brain aneurysm, head injury, and blood infection. So that could be, I don't know, sepsis, I guess? I have no idea. Diagnosis and a magnetic resonance imaging, MRI, CT, and a spinal tap. Basically, they remove a piece of the spinal fluid so they can detect what's going on with that specific part. CT scan is a specific type of picture of the brain, and so is an MRI. Brain aneurysm complications: if untreated for a prolonged period, it may lead to rebleeding, vasospasm, sudden erratic narrowing of blood vessels, increased pressure on brain, hyponatremia, drop in sodium levels, death as well. That's all, guys. I hope you enjoyed. Please click the videos you're seeing on your screen. I see you on the next one. Peace out. Yeah. Okay.